let's talk a little bit about vent modes. Like I said earlier, about 90% of the vent modes inside a medical ICU is going to be assist control or a volume control mode when you're giving full support. And then as you get closer to extubation or trialing extubation, then considering pressure support ventilation. I'm going to focus on those, but I'm mostly going to focus on assist control because many of the providers coming in to help with the surge are going to be dealing with assist control or volume control modes. All right. So this is what we call assist control, which is a volume control mode of ventilation. Now this has many different names out there. It depends on sometimes the company who makes the ventilator and what they want to call it. Some people call this AC, some people call this CMV, some people try to make the volume control even a little bit more comfortable for the patient, and they call it pressure regulated volume control by changing a little bit of the flow parameters and airflow into the patient. This might be VC plus. Whatever is the case, what we're really talking about here is volume control. We're talking about you as the provider and as the operator of the ventilator providing volume and setting a volume, and every breath that that patient is taking in from the ventilator is gonna get that volume that you set. So I'll talk a little bit about the parameters of what you set on volume control. So once again, if these were the buttons at the bottom of a ventilator, in volume control mode, you're going to be setting a tidal volume or the amount of volume that's going in with each breath. Here, we're talking about FiO2, we're talking about respiratory rate, and then also we're talking about PEEP. All right? Now just kind of run-of-the-mill numbers. A tidal volume normal would be about 400 cc's or mLs or 0.4 liters. FiO2, we'd probably start off at 100%. Respiratory rate, probably maybe about 16. And a PEEP starting about 5, unless they're more hypoxemic, maybe up to 10, depending on where you're at. So these are some of the numbers that you would provide. When dealing with volume control, since you're setting the volume, the thing that becomes the variable is the airway pressure. And I'll talk a little bit about airway pressure and peak inspiratory pressure in just a little bit. But this is what you're going to set on volume control. So if you set somebody at these settings, if they're getting a respiratory rate of 16 times 0.4, that's your minute ventilation, you're guaranteeing them that they're going to get that amount of minute ventilation. The respiratory rate times the tidal volume is a decimal. Okay, so for at least volume control, this is what you set. And I should say a little bit about the difference between an assisted breath and controlled breath, because that's the difference between these two, all right? If it's an assist control mode, you're able to get volume control with an assisted breath or a controlled breath. And the difference between those two is an assisted breath is patient triggered or patient initiated. And the controlled breath is basically by the timer of the machine. In other words, if you set a respiratory rate, let's say at, let's make this 15. This respiratory rate that you've set is 15. So there are 60 seconds in a minute, 15 breaths per minute. If 4 seconds goes by on a ventilator and it hasn't delivered a breath, the machine will deliver that breath, a controlled breath, regardless of whether the patient had initiated or not, because it's a controlled breath, so it's coming in from the ventilator. Now the vent will sync controlled breaths with assisted breaths to make sure they don't give two at the same time. And so the difference once again between an assisted breath and a controlled breath is patient triggered for an assisted breath, machine triggered for a controlled breath.